All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Thomas Fuller once said, "Health is not valued until sickness comes." Good evening. Welcome to another episode of BMC Health World, Nothing But Lifestyle. Today we are going to discuss a very relevant topic, something most women fail to identify in the early stages: abnormal uterine bleeding. And for that, today we have an expert on the panel. She's a gynecologist, obstetrician, and also a laparoscopic surgeon. Let's hear it from her side. Let me welcome to the show Dr. Radhika Tilgu. Hello, doctor.
Hello.
We'll jump right away to the discussion.
Yes.
What is the most common complaint that women come up to the OPD?
So I come to see a lot of women who have problem with their periods. So we call this as an abnormal uterine bleeding. They don't have periods for months together. So previously we used to call that as oligomenorrhea, and some women, they have 2 to 3 episodes of periods in a month. We call that menorrhagia, but these two terms are no longer used. And they normally, a menstrual cycle, women can predict, like it comes on the same time every month. It will be regular, flow will be moderate, and occasional pain will be there, they can tolerate it. But coming to the irregular pattern, women do have 2 to 3 episodes of period in 1 month, and they can't predict the cycle. The flow will be often heavy, it is quite painful, and they pass a few clots also that will affect the quality of life. So these cases we tend to see a lot in OPD.
Okay. Is there any particular reason for the change in the bleeding pattern?
Yes. So this causes and symptoms, we categorize women into 3 groups. First will be an adolescent age group. Adolescent age group means girls have just started their periods around 11 to 12 till 16 years. We call that as an adolescent age group. In that, the periods are quite irregular because the hypopituitary axis, what we call, is immature. So this condition usually settles with age. So we don't need to treat them, just supportive treatment is necessary. But there are some conditions like there will be inherited coagulation defects that we need to identify and pick up. And coming to the reproductive age group, that is women between 18 to until 45. So this is the major OPD cases we see. So these patients, first thing when they complain of irregular period, the first thing we rule out is a pregnancy, because in this irregularity they can't predict the ovulation, they sometimes miss out the period dates, and sometimes while they track the period, the patient may already bleed. So this could be an ongoing miscarriage, some ectopic or molar pregnancy. These are dire emergencies, we have to make it out. So any women who come to this complaint OPD with this age group, we first rule out pregnancy. Other conditions would be fibroids, endometriosis, polycystic ovaries, endometrial hyperplasia will be there, endometriosis will be there. So all these things we just evaluate. And there is other age group, perimenopause and menopause, that is 45 to 50 years age group. So these women have lot of hormonal changes happening in their body. So we need to evaluate them thoroughly, because this is the age group where the comorbidities like hypertension, diabetes, obesity, all these add up to this condition.
Just like you mentioned, doctor, I read it in an article saying that around 30% of the women in their reproductive age have AUB. So how can they diagnose this at the early stage?
Yeah. Before proceeding to any lab diagnosis, first the thorough clinical examination is needed. So gynec examination is never complete without a speculum examination, what we do it in an OPD, because not always there will be any systemic causes for the bleeding. There could be some local infections, local lesions we need to see. So if that everything is evaluated, then we order some lab tests like hemoglobin, because hemoglobin will be dropping down in these cases of heavy bleeding. So hemoglobin we have to check. And I mentioned, like in adolescent age group, there will be some coagulation defects. So young girls who are not getting treated with the supportive management, we check for the coagulation defects as well. Another thing is thyroid. And ultrasound is an important diagnostic tool, because it gives a picture of what going in the body. So fibroids, polyps, endometrial hyperplasia, even ongoing pregnancy or miscarriage, everything we can pick up with an ultrasound. Even if these diagnostic methods couldn't pick up any clue, then we go for advanced diagnostic methods like hysteroscopy or laparoscopy.
But that comes under surgical treatment.
Yes.
Right?
Minimal invasive.
Okay. So do all cases require surgeries?
No. All cases don't end up in surgery. There are a lot of medical options. That too we tailor according to the patient's age and the fertility assessment, everything we do, and we offer the management protocol.
So what are the other treatment options that are available?
So the treatment options we usually give is we offer first medical management or conservative management, because most of the cases, majority, they respond with the supportive and the conservative management. So there are medical non-hormonal options as well as hormonal options. Majority of the patients, they respond to the non-hormonal options. In the patients who the severity is more, or when they are not responding to this first line management, we proceed to the hormonal hormonal therapy. Hormonal therapy, depending upon the patient choice, we either give them like a tablet form, or there are some intrauterine devices also, the medicated devices, like we call it as Mirena. So we do insert that. So usually the response will be within 6 months, and patients also are comfortable with this regimen because this is purely controlled by the patient. So we do regular follow-ups, and that is how we do manage medically.
Ma'am, you're talking about medications, right? So I personally know few people who don't respond to medicines. So what if the patient is not responsive to such medication treatments? What can be done?
Usually 6 months of medical treatment, if the patient doesn't respond, we do offer surgical or minimally invasive procedures, as I already told, depending upon the patient's age and the fertility assessment, like fertility requirement. Suppose the woman wants to have another pregnancy, so we can't take out the uterus. So there are such options, like women, if she has a fibroid, we can just remove the fibroid. We call it as myomectomy, or uterine artery embolization procedure, just shrink the size of the fibroid. So then the patients respond well. And suppose if the patient doesn't want a family, she has completed her family, then all the above measures fail, then the last option would be hysterectomy. That is the removal of uterus. We do that.
So won't that disturb the endometrium wall, like for
Which
the
one?
while doing that surgery? Like initial process you said, right? Removal of the fibroids.
Fibroid? No. The endometrium will be intact. Only the pathology will be removed.
Okay, got it. We have read from childhood, ma'am, that bleeding stops at menopause. Then what is postmenopausal bleeding?
Yeah, first we'll understand what is menopause. Menopause is usually average. A woman stop getting her menstrual cycle at the age of 50 to 52 years. So that too, if the woman doesn't have a period for 12 consecutive months, that we consider as 1 year. Na? So she doesn't get a period for 12 months, then we take menopausal bleeding.
So what?
No. Postmenopausal bleeding always needs thorough evaluation. Maybe 80 to 90% cases may be the benign cause, but we should not miss the 10% cases. Those who are prone to get endometrial cancer if they are not thoroughly evaluated or properly treated in time. So for that, postmenopausal bleeding, if even with one episode, we thoroughly evaluate the patient, not to miss that carcinoma cases.
Okay. So any bleeding after postmenopause, in the postmenopausal
menopause,
period,
yes,
should be taken very seriously.
Serious, yeah.
So is there any special diet that these women who have this disorder must take?
Yes, because this heavy bleeding, it impacts the quality of life because the hemoglobin drops down. So women needs to hydrate themselves. They need to take extra 4 to 6 cups of water per day to maintain the blood volume, and they can also add up fruit juices in their diet to collect the electrolyte imbalance if there is any. And they should be taking more of iron and protein rich diet to improve the hemoglobin. So many food options like spinach, lentils, dals, legumes, and even dates, chicken, eggs, all these are good sources, some of the few sources, and including more citrus fruits in their diet like vitamin C rich fruits, they enhance the iron absorption. So along with the iron rich foods, women should also take vitamin C in their diet. A good sleep, any sort of physical activity like stretching, yoga, breathing exercises, they help to overcome the weakness they have and enhance their vitality.
So this is knowledge to me, ma'am. I thought they were only having hormonal imbalances during AUB, but it also affects their immunity as well as their lifestyle altogether.
Everything, yeah.
So that must be taken seriously. Also, this is Pink Month. It is the month of breast awareness campaign. So is there any insights you would like to give on breast cancer awareness?
This is a very good initiative. It's a global awareness thing that is happening around all this month. So this is a very good initiative because most of the women, they have a little bit concern, like they do have inhibitions to come out and speak about this thing. So these kind of awareness programs, they break the fears and the barriers so that women can come up and discuss with the problems, and we can educate them about the screening programs we have with us. So this women can take this opportunity and get themselves tested, because early detection is usually the key.
Yes. Prevention is better than cure. That's it. We have come to the end of the discussion, doctor. We had with us an expert in opno and gynae from Al Hilal Hospitals and Medical Centers, Dr. Radhika Telugu. I hope you all had an interactive and informative session. For more such sessions, please subscribe to our channel BMC Global Life. This is Abjit Joseph signing off.
all your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.